Hello everyone, welcome to you all on this session of word round participation. Myself, Dr. Saurabh Kose, Head and Associate Professor, Department of Pharmacy Practice, ISF College of Pharmacy, Moga, Punjab, India. So, as you know that every day there is one clinical visit is made up by the medics and the paramedics inside the inpatient of a typical tertiary care, primary care, secondary care hospital. So there are various departments, medical specialties in the hospitals like general medicine, cardiology, neurology, nephrology, urology, and dermatology, gynae, etc. Daily, once in a morning, a visit is made from patient to patient bedside to check up the follow up the progress in the disease state condition of the patient. So Uh, welcomes you all. So as you can see that there are a team of medics, paramedics, nursing, physiotherapist, dietitian, physician, and consultation are of various processes. Physical, online, telemedicine now has been introduced by Government of India telemedicine guidelines in the month of March 2020. So by various means of communication, the patient get advantage from the physician. The physician used to take a oath before becoming a physician after the successful completion of a medical degree. This is called as the Hippocratic Oath, which states that they will swear to impart their clinical experiences, knowledge to the patient in a specific manner, honest manner, and at any time of the day, whether it is night time, daytime, so that the better patient outcome and the care can take place. Whereas the pharmacist take pharmacist oath. So in the recent times, there has been some improvement into the ongoing therapy, so-called as the telemedicines from the one room to the whole hospital or to the area of the world where the human interaction in physical manner is not that possible. So with the use of information technology and the services, so this consultations have been now started taking place at various medical specialties where the bedside telemedicine and the robotic surgery, robotic consultation has been started. In India, PGI Chandigarh and there is one center of excellence for telemedicine is about to come in the upcoming years. So ward round, we are today discussing about the ward round. So typically, if we define ward round, it's a visit made by the medical and the legal medical and the paramedics with or alone with the team of healthcare professionals comprising of the apprentice medical students, maybe nursing, maybe PharmD, maybe pharmacist, or maybe of clinical orientation or medical lab sciences from patient to patient bedside to review the follow-up and the progress in the health of the patients. So as you see the typical metrics of a patient care system, which includes the ward nurse, junior doctor, head nurse, patient, senior doctor, records, managers, relatives, pharmacist, physiotherapist, dietitian, ward nurse, head nurse, junior doctor, senior doctor. They all together make a mesh work to care the patient, and these patients are typically responsible for the overall. I would say that the growth, the culture, the management of the chronic illness of the patient. So once you go to the hospital and the inpatient at the bedside, how the ward round has to be start. You should open the session with the pleasantries exchange like good morning, good evening, good afternoon, whatsoever the time is there when you reach to the patient, so that a gesture of a smile of body language within the patients where the patient is vocal and able to communicate with you telling his or her problems or the genuineness of the uh, recovery of the patient. So a nursing station is typically inside a ward where the nursing staffs used to take the records and put at one place of the patient drug administration reports, laboratory reports, and various kind of reports. So the nursing staff, nursing mentor, and the responsible nursing staff, nurse, etc., are the part of this team in the ward round team. And at this time, real-time live discussions and the drug discussions, drug stop orders, or the introduction of new molecules, such kind of practices takes place, which are very empirical and good for the treatment of the patients. So usually once a day, ward round is conducted to review the progress of each patient, and pharmacists do also include themselves in the ward round. Whereas the introduction of clinical courses PHARM.D in 2008 and M.Pharm pharmacy practice, clinical pharmacy, hospital pharmacy, B.Pharm practice are there as a part of a medical ward round team. Meanwhile, diploma students used to do this 500 didactic training in the after the second year of their completion. So they also used to get the exposure from this ward rounds apart from other training module setups. So in this scenario of ward round participation in the practice session, it provides the rational drug utilization concept, decreases adverse drug event, improve patient care, reduces the length of hospital stay and healthcare costs, and it enables pharmacists to contribute prospectively to patient care through the provision of patient care and through the provision of drug information, promotion of rational use of drugs, etc. starts. So at the bedside, there is the patient, and the patient comprises of with the hospitality, where the drugs, where the food, where the patient assistant, relative patient care team, including physician, nursing staff, all together works to look after the progress of the patient onto the bedside. What is the goal and objective of this one? The goal and objective is to improve the understanding of the patient clinical status, progress, planned investigation, therapeutic goals, and provide relevant information on various aspects of drug therapy, pharmacology है, or polypharmacy, drug-drug interaction, drug-food interaction, adverse drug reaction, etc. has to be gain up, and the optimization management of medications, mom monitoring follow-up, ADR, unusual drug stop orders, comorbidity, side effects, adverse events that may have occurred have to be managed, and specifically pharmacovigilance activities, patient discharge follow-up summary has to be taken up. So it's a clinical diagnosis round manner where we go one to one, bat, see, review the patient progress, sign and symptoms, administration of medication, and monitoring parameter, laboratory parameter. It is whether it is biochemical, hematological, or rheumatological, or radiological, depends. Then the intravenous infusions or certain kind of review catheter lines, if these tubes are done, then indirectly reducing the infections, prescribing, deprescribing, dose modification, which includes modalities, intravenous versus oral, decision on the extent of care, whether appropriate on the fertility of treatment is there, a multidisciplinary input forum, formulation of discharge plan, communication of diagnosis and plans to patients, relatives, teaching and training, etc. takes place at the one part. Right diagnosis, right treatment, right time, right place, where once we need to come to show up that this is the one thing which we have to necessarily follow. So the patients coming up with the right diagnosis, right treatment, right time, right place, and any unnecessary drug therapy which is given, which is called as the irrationality. So there should be a standard treatment guideline or the WHO manual. Patient should follow, physician should follow. Such if patient is following a guideline to administer a molecule, a physician must also follow a molecule writing guideline called WHO Prescribing Manual 1994, and various standard treatment guidelines given for any specific disease situation. So wrong drug or the doses are variation and titration, either high or low, any ADRs, inappropriate adherence, or any additional drug therapy. So it provides learning opportunity to the pharmacist, which allows pharmacists to see firsthand how the drugs are used and how it is prescribed to see the effects to the patient. So opening of session, when you are going to the word round, pleasantry exchange, introduction, and feeling how the patient is feeling, then the patient feedback request and verbal communication, non-verbal, any instructions to the residents, interns, junior interns of the medical, so that finalizing the arrangement or arranging next step, addressing the final questions. Then the farewell terminal sequences, breaking co-presence, etc. has to be mug up. Basically, word round is of four types: pre-rounds, register rounds, professor rounds, teaching rounds. So pre-rounds is something which is usually by interns or medical postgraduate students in the teaching hospital, and only a few management decisions are made during these rounds. So trainee clinical pharmacists may join the interns or postgraduates in their pre-rounds and complete the patient medication and clinical review at this time. So pre-rounds. Registrar rounds or the resident rounds. In the teaching hospital, the registrars and the residents individually or as a team conduct ward rounds. So at least once a day at a fixed time, usually in the morning, this ward rounds happens. So these rounds are useful for clinical pharmacists for all levels of experience to join. Professor or the chief rounds in teaching hospitals, the chief unit or the professor in a specialty conducts rounds together with other healthcare professionals, which is conducted for all patients under their care on a daily basis. And this is more challenging for clinical pharmacists in terms of their clinical knowledge. Teaching rounds where academic medical staff conducts bedside cleaning teaching rounds for residents, medical PG students, interns, medicals, UGs, MPharm, PharM.D students. So it is usually extensive rounds and is conducted only a few times a week, which provides an opportunity to clinical pharmacists to improve their clinical knowledge. Like a dermatological patient comprises of the skin related problems, say scabies, acne vulgaris, or some lesions are there. So if a certain kind of exposure is there, it leads to see a real-time case-based scenario to the students to learn quickly. Then pre-round preparation. Pre-round is like pharmacists need to prepare well before participating in ward rounds. Accurate and up-to-date information on the patient's health status, disease management, past medical history is essential for effective participation in clinical decision making. And the pre-round preparation, where the review of medication chart, case record should be completed prior to the ward round. Ward round preparation, which gives an overview of the drug disease-related issues. This may be DRP, drug-related problems, and may be arising during a ward round. So on-job training, we need to see that we should have the proper adequate knowledge of the patient profile, patient disease, and if any kind of drug information which is required, which we should have. We should have medical dictionary, laboratory investigation, patient acknowledgement, and knowledge about the patient, like what kind of disease and it is there, patient is able to communicate with you or not, and anticipation of the review management and communication. And while conducting a ward round, a patient is there for the adequate amount of disease and such knowledge. We should have the pockets handbook, medical dictionary, pharmacotherapy handbook, etc. within us. National Formulary of India, we should have pocket size, then SIMS, that is current index of medical specialty, and MIMS, medical index of monthly index of medical specialties. Drug today, certain this reference books are very useful for the brand names knowledge. Then for physician, PDR called as physician desk reference, one of the significant text which should be within us. And the follow for the essential drug list should be there. Then for practical tips, now I am going to share with the students for the ward round participation that you should have the formulary within you, SIMS, MIMS, patient profile form, pen, couple of pens, and certainly drug information center. You should, after collection of case, you should be checking into the micromedex or some drug information databases for potential medicine related problem or drug related problem concerning the diagnosis. And at the pharmacist during the ward round may comply with the clinical pharmacy level, so-called clinical pharmacy action plan, like irrationality, overdose, polypharmacy, polypathy, or missed dose, or potential drug-drug interaction, drug-food interaction, or the adverse drug reaction may include sub taken up. So interventions can be active, passive, or reactive. So guideline particularly backing up this all the things. So dose, frequency, route, choice, adverse effect, drug interaction, formulation, duration of therapy, action, uses, availability, supply, identification, legal administrative issue, storage condition, etc. have to be counted up. So communication during the ward round, clinical pharmacists are the persons who do the ward rounds basically with the healthcare staffs, medicos and the paramedicos. So to get a good output within the patient, say benefits, therapeutic advantage, therapeutic outcome for that communication is very must part. So called as the patient counseling or patient health education has to be done in a direct manner with verbal and non-verbal clues, body language, and patient counseling aids such as patient information leaflets, etc. DRP is bluffing, guessing, and undertaking to retrieve the relevant information and then communication same to the prescriber. And we should not challenge the medical practitioner's integrity. Then comes is the word round follow up. So completing the documentation, recommended actions, interventions made by the pharmacist during a word round may need to be documented appropriately. Making necessary alterations, the pharmacist may need to make alterations to the patient care plan to meet the requirements resulting from changes in the patient management. Before round, during round, and post round, we have to check up these things and discuss with the patient about the appropriateness, drug therapy, patient feeling about the disease and the therapy, and love, like self belief, and how the patient is feeling about any negative effects of the molecule. It may be side effect, adverse effect, such things, and it should be like a vocal discussion, full and frank discussion, and self-care management, pharmaceutical care management, and telling about the degree of treatment, management, case advice, and the discharge summary. Pharmacists are there to outweigh any kind of drug-related problem. It may be ADR, it may be side effect, it may be adverse effect, it may be drug-food interaction, it may be drug-drug interaction, etc. So that this adverse drug reaction and the pharmacovigilance uh, to take place to avoid any kind of chronic drug interactions. So, clinical pharmacists definitely play a vital and significant role in such circumstances, having adequate background knowledge of the pharmacotherapeutics, therapeutic drug monitoring, pharmacoeconomics, health economics and outcome research, health related quality of life, and various biodiversity patient where they can understand these values which can be inculcated into the clinical pharmacy curriculums like PHARM.D and MPharm pharmacy practice. So they do interact for the drug related problems, pharmacists, and identify the problems which are definitely required for the better patient outcome, pharmaceutical care, patient safety, and efficacy. So during this, DRPs have to be taken up during the ward rounds. Antibiotics, AMR, ADRs, overdoses or underdoses or high doses, missed doses, or any kind of use of narcotics, drug cardiacs, or no valid indication, so-called irrational use of antibiotics, antimicrobials, antiretrovirals, antimalarials, the broad categories which are reported into the World Health Report 2021. Irrational, these are the categories which are used most widely irrational. So medicine related problems which occurs due to the medicines which has to be solved, like some anatomical and physiological changes if it is there due to the medicaments, like change in the speech, confusion, depression, delirium, insomnia, or inconsistence, lethargy, loss of appetite, falls, etc. So this types we should comply with the medication therapy management, where the pharmacotherapy, disease management, pharmacoeconomics, genomics, anticoagulation management, clinical services, patient counseling, medication safety surveillance, health wellness, public health, immunization, etc. takes place. So there will be a patient profile form called ward round summary last in the attached, where the subjective, objective assessment and plan in the SOAP format. We do collect the every kind of process, and this ward round summary come up with the follow up, where all the diagnosis, parameter, examination, general examination, impression of the diagnosis, and the practice process comes up. So this is what observation, uh, hypothetical decision, therapeutic goal, and offering the help. So this is what we have to come up: plan, act, plan, do, and study. And whereas we come on to the conclusion of this session, components which we do can do in the word round participation is like patient care, pharmaceutical care, learnings, supply of equipments, environmental cleanliness, and better patient outcome. So, admission orientation of the patient, assessment of the patient, progressive patient, like progressive care, disease state management from chronic to subacute and from subacute to acute. so called as severe to moderate and moderate to bilkul minor. That is what is required. So records, reports, client teaching, etc. has to be done. So ladies and gentlemen, thank you for watching this session on word round participation.